Welcome, everyone, both on Zoom and on Facebook Live. I'm Bruce Shapiro, Executive Director of the DART Center for Journalism and Trauma, a project of Columbia Journalism School based in New York City. We're here today on the latest installment, May 7th, 2020, of Reporting and COVID-19 Conversations with Journalists, an ongoing series of conversations for journalists, I should say, an ongoing series of discussions, both with news professionals and with experts, touching on the wide range of journalism issues raised by work during this period, both reporting on coronavirus and other issues that emerge in the course of this pandemic and the special challenges of this unprecedented period. I am very happy today to be here with my colleague and friend Dianne Solis, who is the social issues and immigration reporter of the Dallas Morning News. She's been a Wall Street Journal reporter, a Nieman Fellow, and a DART Center Ochberg Fellow. She reports at the intersection of vulnerability and injustice with a depth and compassion and insight that that have few equals in the United States right now. And in the course of covering coronavirus and the issues emerging in the wake of that, she brings the unique perspective of someone who already is immersed in several different beats touching on the most vulnerable. As we're talking today, I should say that her community in Dallas and in Texas is erupting in a couple of interesting news stories. There's an outbreak of COVID-19 at a poultry plant, which Dianne has been reporting on, and there is enormous storm of controversy involving the jailing of a salon owner who defied the state's closure order and defied a judge's order to remain closed. But behind this, we have huge populations who normally are not getting much of the spotlight and not getting a whole lot of journalistic attention in the course of this fast-moving story. That is Dianne's turf, and we'll be talking about some of that with her today. Dianne, it's great to have you here.
Thank you so much. I'm really happy to be here too.
When I've been looking over your reporting in the last few weeks, it has struck me that over and over again, you are touching on invisible populations and invisible added layers of suffering in this pandemic. You have done reporting on families who are not getting stimulus aid, money under the CARES Act, because they are mixed status families where one family member is undocumented. You've been reporting on conditions in immigration jails where detainees who are testing positive, brought from the Northeast, are bringing infections to the Prairieland detention center. You've also been talking about community-based aid efforts and other things that are outside everybody else's, off of everybody else's radar. That puts you a step ahead. I think what I'd like to talk about, since you were on these kind of broad beats, immigration, social justice, as the pandemic unfolded, let's start by talking a little bit about your process. How did you turn to begin to clue into COVID-19 related stories? How did you begin to focus your reporting to find the stuff that others were missing?
There were two stories initially that I was called in to work with colleagues, and my editor is a wonderful man and very compassionate. Right away, he turned to the border and had me working on a story on whether or not the huge migrant camp of asylum seekers in Matamoros would erupt in COVID. And my colleague, Alfredo Corchado, at the other end of the Texas border, was looking at Juarez and what was happening there. And of course, I wasn't at the border, but I was noticing the quality of reporting done by the state health officials for the Mexican border states, and that there were two states emphasizing imported COVID. So we were often running with a story that looked at that.
Mhm.
And because I'd already been to the border 3 months earlier, I was able to call sources
Mhm.
and talk to them.
And let's talk maybe for a few minutes in particular about this mixed family exclusion issue. This is an issue affecting large numbers of people, that clearly is a major in your community. How did you find your way into that, and what are you finding? Let's talk about that.
We got an email from somebody who said, I'm a U.S. citizen. I have a social security card, and my husband's an immigrant, and this isn't fair. And my colleague got one too. And then I realized, my God, how could this happen? And this could be potentially a huge story affecting a population much larger than those that have DACA, youngish people who got work permits under a special program, and that's how we got started. And the first person we talked to was in Fort Worth, and was just a very, very strong woman who spoke in perfect sentences and told her story powerfully. And then it was easy to find other people that were like her.
And what's your sense of the scale of this issue? How many families do you think we're talking about that are not receiving federal aid because they're mixed status?
Families, at least 1 million people, maybe as many as 5 million, and that would include 4 million children who are US citizens with at least one parent who's unauthorized immigrant.
That's an extraordinary, huge number. If reporters are interested in digging into this in their own communities, what are some pathways to find out who these folks are, to find out, to make the kinds of contacts that can produce reporting on what is clearly a huge national issue?
Facebook. There's a group started by this same woman who initially contacted us. She's in Fort Worth, and it's called Mixed Status Families United. She's got more than 10,000 people in that group now. It just mushroomed.
Mm-hmm. And let's, I should say also to everyone on the call that the way we're doing this is that Dianne and I will talk for, the next 15, 20 minutes or so, and then we'll go to questions from you, which you should submit via the chat. We may or may not get to everyone, but we'll ask as many as we can. What's been the response to the stories on mixed status families that you've been doing?
Every day we get emails on this, people who want help, people who have particular situations that aren't so obvious, such as veterans. They want to know if they're covered under military families. They're not, unless they were in the service during the tax reporting year. People who say, my spouse is applying for a green card, the green card of legal permanent residency, and has not received the SSN yet. But really, truly, we're in the process. There's a lot of people who are in that group.
And has there been any substantial response from government at a significant level?
Yeah, there's legislation that's been proposed, and Nancy Pelosi is behind it, as is Representative Joaquin Castro, and it's called the No Taxpayer Left Behind bill. Furthermore, there are, I believe, 4 lawsuits now. 2 of them are class action that seek to address how these people were very surgically excluded from the CARES Act.
So lawsuits might also be another pathway in for regional reporters looking in their own area. Let's talk about another population you've been focusing on, uh, immigrant detainees. You tracked this outbreak at the Prairieland Detention Center, where now there are, what was the last count, 24 cases, or is it larger than that?
It's now 42.
And and this is a cluster that emerged over just a few days. You 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 made the startling revelation in one of your stories that this outbreak actually began with the moving of a detainee from the Northeast down to Prairieland Detention Center. How'd you do that? How'd you figure that one out?
They were moved from Philadelphia area, and the Philadelphia attorney had 4 clients, and he contacted me, and he
Okay.
was very interested in stories I had done, and we discussed another person who had appeared in a story who was in Prairieland and really worried that he would get coronavirus. So when I talked to him, he was very clear that these 4 clients had been moved from Pike County in jail in Pennsylvania in the middle of the night, and that there were, I believe, 21 of them. And they were put on buses, i.e. in small closed quarters, and then on a plane, the same problem, closed quarters, and the coronavirus spread that way. It's
So,
believed.
so this is a case where, as a reporter, you were able to do the work of epidemiology, of really tracking essentially a petri dish of detainees. Um, if folks want to be looking at the question of health conditions in their immigration jails and similar detention facilities, again, what are the best pathways for that? Clearly, you had some help from an attorney. That's always a good one. If people want to lean into this, what's a good way of doing it?
Attorneys, calling immigration attorneys, looking at any suits that have been filed in your federal district for under the writ of habeas, or for a temporary restraining order to get people released.
Mhm.
Um, those are 2 excellent ways, but there's also an app that's called Getting Out,
Mhm.
and you should download it. And a lot of people use it. They have to use it for
Mhm.
certain detention centers. Uh, and you can connect to people that way if you know the surname and what's called the alien number.
Okay. As you have reached out to your sources on stories like the CARES Act, or Prairieland Detention Center, whether it's sources among attorneys and families, or the kind of official agency sources who may talk on the record, off the record, or not at all, um, have you found that that dynamic has changed at all over the course of this pandemic? Um, how are sources? How's the interaction between reporter and source altered by this situation?
I find that undocumented immigrants want to speak. They want their voice heard. They're
Hmm.
desperate. And I'm very surprised, because this is the signature issue of the Trump administration. Uh,
So when you say there's typically, for reporters covering migration, lots of fear among undocumented immigrants that will stand in the way of their speaking. Has that has the concern about being identified and deported been uh, kind of swept over by fear about coronavirus, or what's driving this urgent desire to have their stories told?
Desperation. I think it's desperation. There are people who don't want their names used, but there are more people who do want their names used, who don't want to be voiceless and faceless and nameless. I'm taken by that. I'm surprised by that.
I should say this is a consistent theme that we're hearing from reporter after reporter in this series of conversations, that a variety of sources are particularly keen to talk now, particularly keen to have stories told. Are you finding that among um, sources in the system too? Has that dynamic changed at all?
Yes, there's an NGO that I talk to a lot. They're very aggressive with me. And there are reporters, colleagues,
Yeah.
spouses who are kind of losing it, and I put them in that category. That day it's been rough. It's been rough.
Well, and this is the reality of reporting at this time
Yeah.
right now. When you and I were talking earlier in preparation for this call, we kind of ran through a few of the things that are on your mind that you're looking at in the communities you traditionally have covered, including immigrant communities, including other kinds of vulnerable communities, and and then some of the emerging issues that you think we're going to be needing to do a lot of reporting on in the coming months. One of them you mentioned was toxic stress in children and the impact of that. Talk a little about kind of what you're seeing and what you're thinking as the job of reporters right now on this issue.
Okay. Well, they're particularly vulnerable. They're children. And I have gone and done deep narratives on two families to look at toxic stress and the impact of a potential deportation. And in one case, there was a family of girls with one son. And in the other case, it's two sons. And I've, they're in a lot of pain, not talking, not wanting to go to school. This was when the deportation was going on. One kid was only 16 and his hair was turning gray already. And so they've been demonized, or their parents have been demonized. They feel like they're a piñata. And now you've got this monster of COVID coming. And
Yeah.
I think they're going to be in worse shape.
And without giving away your own good stuff, if local and regional reporters or reporters in other countries are listening to this, trying to strategize a little bit how to cover this issue of toxic stress in children right now, what would be some top tips for that? What are some, getting at children is sometimes a challenging issue. The privacy issues are greater.
Yes.
They're not always in a system. There's some special challenges. Talk about how folks could go about that.
It's going to be more difficult because one of the things that I did with these two families is I kept showing up. Yeah, I would call, I would text. I would chat with them about school, how it was going or how it wasn't going very well at all. And so it's going to be hard, but it's so important. I think texting, maybe video calls, asking maybe for them to do a video for you to show them what life at the house is like. That might work. And again, it's a huge issue. We're hearing in Guatemala that people are being stigmatized who are deported back. And it's just horrible. It's just coming out now.
So
And
really,
the Guatemalan officials have been very good at talking to a group of us on WhatsApp.
okay. So actually, one particular tip is don't just look at the North American end of this, at the U.S. end. Really be developing sources on both sides of the equation and among all the different players involved.
That's correct. There's some strong NGOs and shelters in Mexico. There's the same in Guatemala. And, um, and again, I've got to hand it to the Guatemalan Migration Ministry and the Health Ministry. They've really been good with the foreign press. They
Yeah.
wanted the story out that I believe it was on March 26, a plane came in with someone who was 3 days later, if I recall right, tested with coronavirus. And that story has been replicated again and again with deportees.
We'll be going to questions from the chat in a minute, and folks, you should by all means start sending them in, and we'll sort of filter them as they come. But let me ask about a different kind of story you've done. You've also done some stories on people who are trying to help, on remarkable interveners, and you told the story about someone named Padre Jesus. Talk about him a little bit, why you did that story, and about him.
I wanted a fresh approach to immigrants who were trying to survive and had lost their jobs or had reduced hours. And there was sort of a sameness that was coming out in the press about these people. And I knew about him. I knew that he had grown this church from a warehouse into what may be the largest Catholic congregation in Dallas.
Mm-hmm.
And that he had a lot of artistic gifts. He sang, but not just normal mass kind of chants, but he sang songs with a tropical band behind him. I had seen this once and I was blown away. And he also paints religious paintings, but they're done in the style of Modigliani. and he's an immigrant himself from Michoacan. He just connects well with people. Mm-hmm. And so he was giving food bags out to his parish, and he was like the delivery boy, running up to the cars and had something nice to say and asked, what do you want?
And in your story it's so vivid, and he comes across as such an engaged and vital person. It must have actually been, or I should ask this as a question without making presumption, was it helpful for you, kind of emotionally and in terms of professional muscles, to shift gears and talk about an intervener like this?
Oh, it was wonderful. I needed to do that. Yeah. Talking, especially, I needed to do something like that after the Prairieland detention story, where I talked to somebody who was suicidal. So shifting gears like that was very, very important. Yeah. And I think it's important for the reader as well. How many stories about despair can they read? They need a story about hope or resilience or someone who's heroic.
And I think also a story about agency, about finding a way to take action and doing it. I think these are stories that readers need now. It's not about offering false hope or pretending the problem doesn't exist, but showing that there is some possibility for action, even while the big players are up here making political noises at each other. Someone like Padre Jesus is moving forward, taking action in his own community. I think that's really important, along with what it does for you as a reporter. That sense of refreshment is really nice. Here's a question. Ashoka from the ACLU asks, I'm curious whether you've tried to reach folks who were removed from the U.S. since the March 20th public health order that effectively ended asylum. Ashoka says, I've been talking to folks in shelters in Juarez and Laredo. It's been hard to pin down where they're ending up. Have you found anyone like that? And if reporters are looking for sources, and I should say that Ashoka is a journalist who works with the ACLU, what's a good way to find folks like that?
Through collaborations with Mexican or border journalists. That's an excellent idea. And we are already working at the Dallas Morning News with somebody in Juarez
Mhm.
Valeria Olivares. She's been terrific. And she actually lives in Juarez. So it's been very, very helpful. I'm in discussions right now to work with two other people at the border. But you got to do collaborations. It's immigration, it's sort of sin fronteras time. No, no borders, just like the migrants. You got to work. We all have to work together.
Well, and of course, we're reporting on a virus which knows no borders either.
Exactly.
So journalists can emulate COVID-19 in our in our in our tactics. Um, you know, these stories that you've been doing are high impact. They're really important. They also are fairly stressful. These are, you mentioned everything that was involved in the Prairieland detention center story involving highly distressed inmates and families and agitated attorneys. The same thing certainly is true in the mixed status families and in everything else. You're now looking at a poultry plant where people are probably going to be dying. How have you managed your own stress uh, over the course of this particular story? Is there anything you're doing a little differently, or any lessons from past intensive reporting experiences that you think can be brought to bear here?
I do a lot of gardening.
Mhm.
I'm working from home, and so I can go out in the garden, and I'm out there every day. It's almost like a, a mini meditation.
Mhm.
Uh, and I'd like to say I do yoga every night. I don't. You know, I do try and take a hike into some um, into this prairie land that's actually nearby my house.
Mhm.
Doing that maybe 2 times a week. That's really good.
And are there any strategies you use? I'm curious, during the day or at the immediate end of the workday or something, to kind of set up boundaries and clear your head. This is a question I know I'm getting a lot from journalists who are working at home and trying to figure out how to be productive as journalists and at the same time not have their domestic life completely invaded and taken over. Um, what are you doing around that?
Not much. Well, uh, I try to do to prepare some of the meals that my my boyfriend does a lot of the cooking.
Mhm.
Um, I'm not setting probably enough boundaries. And I enjoy discussing what I'm working on with him because he has very good questions.
Um, Maria Arce, who was an Outbreak Fellow with you in 2012, mentions that you have this great editor who's been receptive. What tips can you give to journalists who might not have editors that are already fully committed to these stories? How can we get editors interested in them right now? How can we get the attention of our colleagues to stories about invisible populations in the midst of this coronavirus epidemic?
Choose your lead characters very well. Who are you telling the story through? That's really important. There's something I'm working on involving an immigrant population, and I'm going to probably tell it. If I'm lucky, we'll tell it through the eyes of a doctor, a family
Mm.
practice doctor who treats people. And I'm hoping that will make the story more accessible to readers who haven't had an immigrant in their family for several generations.
Mhm.
Telling the story through the prism of a priest, that was another way. Or through the prism of a teacher who finds that the immigrant children or the children, US citizen children of immigrants are struggling more. The issue may be they don't have internet access because
So,
of poverty.
so selling it to editors is also, it's in a way a subset of selling it to your readers, of selling it to the public, that you need to be relying on strong characters and stories to get people's attention right now. Is that kind of how you're thinking?
That's correct.
And in addition to characters, are there other steps you're taking in the narrative, in the writing, or in the story choices, knowing that readers have a lot of both a lot of competition for their attention and a strong desire sometimes to turn the page and not talk more about an issue they're already exhausted by? What are, along with characters, are there any steps you're taking to kind of combat audience fatigue to get their attention?
Telling a good tale is paramount. Whatever you write about, telling a strong tale, a very human tale. With the issue of toxic stress, we sometimes refer to it as, oh, that story about the boy and his tuba. And
Yeah.
he loved band practice and played the tuba. And when his father went into deportation proceedings to save money for the family, he stopped going to practice.
Mm-hmm.
It was a release for him. And after we wrote the story, several checks came in to pay for his band fees.
Wow.
Because that was what connected people to him.
Yeah.
They played an instrument in band.
So the more particular you can make it, the more of those details that connect the ordinary parts of someone's life, of a character's life, to readers, the better the engagement is likely to be.
I think so. That's the trick.
Yeah.
I may be writing about a vegetarian who was in detention, and it was a horrible experience for him, but he is rather humorous about trying to stay vegetarian in detention.
Well, and that suggests don't be afraid of irony, and don't be afraid of a sense of humor in as you're looking for little corners of light, I suppose, as well, right?
Yeah, that which makes us human connects.
Yeah. And Lisa Fuentes asks, is there COVID-19 testing available at the border or at transitory points in Mexico? I mean, what is the testing situation in the immediate border vicinity right now?
At the border, it's really bad in Juarez right now. And it's just emerging as a huge problem. In the state of Chihuahua, where my family actually originated, some of my family, the bulk of the cases are in the border city of Juarez.
Mm-hmm.
In the border state of Tamaulipas, that's not true. It's not Matamoros.
Mm-hmm.
Where you see the big COVID outbreak.
Okay. Pau has a question about, in a way, asking us to look forward after the coronavirus pandemic abates a little bit, and is wondering about migrants who are making the choice to try to come as undocumented arrivals. That may increase after COVID-19. Are there any attempts to educate potential migrants, any stories to do about existing opportunities in their countries of origin? Is COVID-19 changing, I guess might be another way of putting it, is COVID-19 changing the incentives for migrants to stay in their countries of origin versus coming to the US?
I think so. I think you see that in the apprehension numbers at the border. The flow isn't as high. And I know that the Guatemalan consul in Texas has been very, very aggressive about urging people not to come and urging them to avoid quote unquote unscrupulous people. And that's code for coyotes, who might try and say that now's the time to come. He's a really interesting character. And has done very well, and is now going to be the consul general in Los Angeles, which is a huge post.
Let me ask you something else about the intersection of healthcare and your other issues. You know, one of the strange for U.S. Journalists and U.S. audiences, one of the strange things about coronavirus is the way it takes what has been this huge national issue anyway of healthcare coverage and healthcare access, and put it now at the very center of a life and death international pandemic, where the faults in the American healthcare system are driving this pandemic even more powerfully than it might otherwise be. Developing sources in healthcare systems, whether it's a healthcare system that works with migrants and immigrants, healthcare systems in jails, healthcare systems at the community level, can be really challenging between confidentiality rules, the fears of undocumented folks who are looking for healthcare. How can we be developing, where should we be looking to develop those kinds of stories now? You and I spoke a little bit about the whole public charge rule and how to think about that journalistically.
We started going to community health fairs, and which are free. And there was a one they've been doing for 15 or 20 years in Dallas, and the Mexican consulate is very involved. And that this past year was just huge. And so we talked to a lot of people there, and an indication of how public charge fear was growing was the size of the crowds that came for the free health fair. And then there were some smaller ones. And I started going to community health clinics where they do either charity care or they do reduced cost care. And there's a great tradition in Mexico of homeopathic remedies. And so we went to flea markets where they're covered. They're in big warehouses and people have booths. And there was a lot of action there with these homeopathic methods.
And I assume that those kinds of community fairs, whether they're community healthcare fairs in this country or the flea markets, those are probably now shut down, or are they still going on?
One fair was quickly canceled because medical staff didn't want to come. They were too busy, they said, because of the outbreak. And I haven't been inside a flea market. My colleague went to one when Texas opened up, reopened up last Friday.
So what, I mean, the kind of broader lesson in that is to really know your community and where people go for healthcare advice, information, and attention anyway, whether it is community health fairs, flea markets, both the formal healthcare system and the informal healthcare system, and just show up. I mean, it sounds like that crucial reporting lesson of just showing up has been really important to developing these stories.
Yeah, it's essential. But now we can't just show up. But if you had done a lot of those stories before, you can pick up the phone.
Yeah.
And I think that we now have to over-report and over-organize to overcompensate for this closure, the social distancing that we have to.
So what does over-reporting look like? What does that mean to you?
Working a little longer hours, always asking anybody else that I should talk to, anything you want to add, and gathering up as much information as you can, and then organizing it digitally so that you have the sources and their contact information already there. We can't go back to the office so easily and pick up notebooks, right?
Yeah.
Where you wrote that essential info on the back of the notebook. Yeah. That's not happening. Yeah. So
We'll take one or two more questions from the room, and then I'll have one or two final questions for you. Emma Jones from ICE out of Tarrant Coalition wonders if you can share your contact information. If that's okay, Kate will simply share it in the chat for anyone
Okay.
who's on the call, and or as you've already done that. Okay. Let me ask you one thing. If you were to imagine a national or indeed cross-border kind of SWAT team of journalists looking at coronavirus related issues on your social justice beats, what are the one or two issues that you think would benefit most from really systematic journalistic scrutiny at this point?
I'm very intrigued by the questions I'm being asked about whether the flow will continue
Mm-hmm.
and what coyotes are using as a pitch.
Mm-hmm.
I think that's an important story, an important public health story. I'm also very worried about stigmatization and backlash, whether that is because of deportees who went back to pick a point on the globe, or whether it's within our own urban environments like Dallas, and a family has two people with coronavirus and people are writing ugly graffiti on their doors. I think we need to be paying a lot of attention to the backlash and to report it with great accuracy and with compassion.
Mm. And as kind of a final question, looking at your, again, your particular beats and the way they play out in your region, immigration, migration, labor injustice, healthcare, all of these things. 3 months from now, what do you think the story is going to be?
Second wave of infection and political backlash, sociological backlash, toxic stress. And there are educators who are now looking at measuring the performance of children of immigrants and immigrant children.
So with that in mind, let me end with a kind of a very functional question, since we have a room full of reporters here. How do you manage to organize your time, your material, your brain so that you're following the breaking story and yet doing that kind of strategic thinking that enables you to pursue some more investigative angles, begin to look a couple months out at some of these emerging issues? How do you balance that?
I talked to my colleague Alfredo Corchado a lot about long range issues that we should be looking at and what do we think won't be covered much, and what we can do about that. And I hope my editor's not listening, but we don't tell the editor right away. Everybody knows that trick.
No editor will be surprised to hear that.
Well, you want to know that you can deliver, and so you do a little. You keep reporting on it. And because I work with a crew at the Dallas Morning News and our wonderful sister publication Al Dia, that's very international, that helps a lot.
Yeah. Well, I think that's as good a place as any to wind up the conversation on. Dianne, thank you for your reporting. Thank you for your time now and your generosity in sharing all this insight on reporting on some of the most persistent gulfs in social justice and how they're being affected by this global pandemic.